everyone, welcome to Nurse Studio. You may be questioning why am I dressing like this, but this is my friend Shauna Willet.
Hi.
And we did a placement together to Indonesia last year. We're now celebrating a year of this travel, so I thought this outfit would be perfect for the occasion. So please welcome Shauna Willet. She's a pediatric and mental health nurse, basically two jobs in one, and the human version of a to-do list, endlessly organized, deeply caring, and always checking in everyone but herself. She is the queen of musicals, and name a show, she's definitely seen it. Shauna, welcome to the studio.
Thank you.
So excited. So I'm just gonna tell a little story how me and Shauna met, because I think this is very chic. This is a story that doesn't happen every day.
No.
So I was on I think it was Heathrow. Was it Heathrow?
Yeah.
Heathrow Airport, and then we're about to land on the plane.
No, we're going to take off.
We're gonna take off
at the
yes
gate.
Yes. So then I was with this guy because we were all going together. He was from the town I live as well, so we traveled together to Heathrow. And then we're just gathering, and then Shauna at the end, she was like, "Hi, are you going to Indonesia?" And we were like, "Yes, are you Shauna?" This is how I met Shauna.
Yeah.
I don't think you met many people like this in your life. This is very chic, and I felt very posh in that moment. So tell us about yourself, because whoever is watching may not know you, because Shauna is a bit shy.
A bit. So my name's Shauna. I am a child and mental health nursing student. So I'm a final year student. Yeah, we've got there. Well, we're getting there.
Yeah.
Last little bit. I don't know what else to say.
She's very young. Very young.
I'm 22.
22,
Yeah.
Shauna, my little Shauna. She's leaving. This is the problem when you take a degree outside your town, isn't it?
Yeah.
So tell us a little bit. I know a little bit who Shauna is without nursing. So outside your nursing world, who are you?
Well, I'm very family centered. My favourite animal's cows. I love musicals, as Sylvana's already said. It's a bit of an addiction at this point. I need to chill out a little bit. Yeah, favourite colour's purple. I'm from an island, which we were talking about just now, weren't we? How I used to get a boat to school. And Sylvana was like, "That's crazy." And I was like, "Yeah."
That's me. Unstoppable Shauna Willet. So I've always been very curious to hear your stories, because it's so different from what I'm used to, because she is a pediatric nurse, so kids are her bread and butter, as well as mental health. So she is a mental health adult. Well,
Yeah,
all ages.
yeah, everything.
So please tell me, why did you just decide to choose that path?
So mental health was actually a complete surprise to me. Every other course that I applied for was just solely children's. So I've had like past experiences with like children's nurses. I was like, wow, that is what I want to be. And then I had a friend who had anorexia, and her care, let's just say, wasn't the best. And I thought, actually, I want to make a difference in mental health as well. So I went into mental health thinking that maybe I'd use it more in a paediatric setting, on like a general ward. And then took that forward, kind of did the course, started the course, and the way it works is kind of 1 year in children's, 1 year in mental health, and then I got into mental health and I was like, wow, I actually really like this as well. So yeah, just kind of went from there.
Right. Oh my God, it's crazy. It's too emotionally intense fields that you need to keep up apart from your life,
Yeah.
like binding it all together. I can't begin to imagine what it's like.
Yeah, I mean it's the same with any nursing really. It's they're very unique fields, which is why I love them so much. But yeah, it can be tricky at times, but the good outweighs the bad.
So, Shauna, it's been like, I don't know, for both of us, it's been 4 years
Yeah.
of this degree. So I kind of know a little bit of like goods and bads. Obviously, this journey, 4 years is a long time.
Mm.
There's a lot of things that change. There's a lot of bad moments and tears and happiness and
Mm.
everything in between. Like, is mad. Is a mad journey.
Yeah.
So, could you tell us, please, like, how do you stay grounded when you're constantly looking after other people's well-being? Like, what makes you connect back to you again?
That's quite a good question, actually.
Thank you.
I love reading. I love spending time with family and friends. Trying to keep those two parts of your life separate. You know, the work you, uni you, and then the personal life you. And it can be quite hard. There can be a lot of blurred lines. But I try and like take personal stuff and leave it at the door of work, and then it's just work. And then come out, leave everything at work as much as I can at the door,
Well, yes.
and then come and just spend time with loved ones really, and try and process everything you see, don't suppress it, get through it, work through it, and then move on and live happily.
Yeah. Do you feel like you apply the techniques you learn?
Yeah, I think I've started to, especially in mental health. There's a lot of different skills that you teach and learn, and I've definitely started to apply them, and that's been quite helpful.
So do you think that definitely helped you going through as well?
Yeah, I'd say so.
Wow, that's mad.
Mm.
Please teach me. It's so difficult to, like, I've talked so many times in the podcast as well. It's so difficult, so complex to have a life outside world.
Yeah.
And I think you do that so well.
Oh, thank
You've got a boyfriend, you go see your boyfriend, you go see your family whenever it's possible.
you.
Obviously we have this intense placements that we can't just leave.
No.
Then you see all these musicals and I'm like, Shauna, do you have an extra hour in your day?
I wish. I wish.
I don't know how you do it. She honestly does it all. It's unbelievable. So what's the moment in your nursing journey you will never forget?
I think there's quite a few.
Oh, please. Get the popcorn.
Good or bad?
Anything. I'm willing to listen. Anything you've got.
Um, I think my first day in both on like a children's placement and a mental health placement. My first day in children's, I was a scared little 18-year-old on a little placement, looking after, working alongside nurses, looking after patients. And my first placement was on a neonatal transitional unit. So it was kind of babies that were admitted with jaundice or with problems feeding or maybe safeguarding. And I remember my first day and just learning, looking at how nurses interacted with patients, how they helped with the bonds between like parents and children. And I was like, wow, this is actually like, this is what I've worked my whole life to do. And now I'm actually getting a chance to like be a part of it and eventually do it, which I've just finished my final children's placement. And yeah, and I kind of got a chance to do that there, and I was like, it's just such a privilege to do that. And even then, I was so many times reflecting, like, wow, this is actually like such an honor to be like a part of.
Mm.
Um,
Pinch me moment, isn't it?
yeah,
Yeah,
it's a
like,
big pinch me moment.
am I deserved
Yeah,
this?
yeah, yeah, definitely. And it's the same with mental health. My first day, I was on an acute assessment unit. So a lot of the patients there were detained under a section of the Mental Health Act. So they could be deemed not to have capacity, or some of them were informal. Um, and even then, like, I had a bit of a wobble my first day. I was like, oh my gosh, this is so different from children's. am I going to be good at this? Is this going to be okay? I think like my biggest moment was at the end of my first placement in mental health, and I was like, I've been able to spend like 6 weeks here. I've seen such an improvement in some of these patients, and I've been able to be a part of it. It's very different from physical health. Like sometimes in physical health, you can see like a broken bone. You can physically see it get better. Where recovery in mental health is defined differently, and it can be harder to see. So it's all about reflecting back and kind of working towards goals, and that's how you measure improvement and recovery. And I could definitely see that reflecting back on that first placement. I was like, wow, this is an honour as well. Like, I want to do both of them. I love it all. Like, yeah.
Wow, that's mad. I never thought of that perspective.
Mm.
It's crazy, like, to think that. So you started on this hospital and then you went back on like your final year.
Yeah.
Wow. I think it's good to have that time spare to like absorb everything.
Yeah.
And wow, it's crazy. Oh my god, thank you for sharing that, honestly.
Yeah.
Could you tell us a little bit like what is your experience? Because I've got no idea of what's a day in a life as a mental health.
So it can look very different depending on which area of mental health you work in. So you've got inpatient, you've got community. Okay, they're kind of the main two things. But you've got placements. You've got areas like acute assessment units. You've got different teams. So where we're training, we've got teams like a crisis resolution home treatment team. We've got places designed especially for people with personality disorders. We've got a lot of things. We've got quite a lot of services around us, which we're quite lucky to have. So if I take my last placement in mental health was with the crisis resolution home treatment team. So that provides hospital level care in the community. So it tries to prevent patients being admitted into hospital. So the team I was with had quite a big scope for its region, but they also had other teams that bordered the region as well. But we had, I think, about an hour and a half radius around us, maybe a bit smaller than that actually, but quite big. So we would go in. So our shifts, the hospital I work in, the shifts can vary. Normally they're 7 a.m. to 9 p.m. But
7 a.m. to 9 p.m.
yeah.
That's mad.
Yeah.
That's 14 hours.
Yeah.
I think that shouldn't be allowed. Because you're working with mental health, like your mental health is gonna be all over the place.
Yeah, it can be tricky, especially the shift times. It can be a lot, but you normally get through it okay. You've got like every team I've worked in is really good, and they're really good at supporting each other. So it's not, you don't feel it too much. It's okay. But yeah, so community, kind of go in. You get a handover of all the patients. You liaise with other teams, and then you don't really have like assigned patients. You just go and see. You kind of have a group discussion who wants to go and see who, which patient. If you've got a good relationship with one patient, would you prefer to go? You kind of get that say in it.
Right.
And then you'll go and do a home visit with that patient. Sometimes it's going for a walk in the community.
But do you go alone in this?
Sometimes.
I'll be terrified.
So the first time you go and see a patient, they will be assessed with two people.
Oh.
So
do you have like security call buzzers or something?
No. There is a safety process in place where you can phone the office that you're working in and ask for something. Like there's like I won't say it just to protect people, but there's like a thing in place where people are protected, but no, we don't carry alarms or anything with us. So in that assessment, it's quite a long assessment. You get like a complete detailed history of both the patient and their family, what's going on with them, what you think you both could achieve by them being under the team. And you kind of go forward from there whether they're going to be accepted onto the caseload or not. And if they are accepted onto the caseload, sometimes it's identified in the risk assessment that two professionals need to go out and see the patient. So if that's the case, then that would be in place to protect people. But also that's quite flexible. So even if, say, a patient's initially assessed to only need one person to go and see them at a time, if professionals feel a bit unsafe or uneasy, then, you know, 9 times out of 10, another professional can go out with them so they feel safe, or like that risk is managed a bit more.
Has something ever happened? Like someone got physical?
Um, I not when I was there. I think it has happened in the past, but so the team's quite intensive. So you're normally seeing patients at least once a day, or maybe every other day. So you're seeing them quite a lot.
Oh, frequent. Okay,
Yeah.
okay.
So you're
Okay.
seeing them quite a lot, so you can detect quite well if they have any changes in their mental state. So those changes are then fed back to the team, and then you're constantly updating their care plan, updating the risk assessments as to what needs to be in place to protect them, but also everybody else. So if it gets to a point where you think that they are a danger to you or they're a danger to others, then you'd think about other things that might need to be considered, like a mental health assessment, or whether they would benefit from an informal admission. So you'd have to like start looking that way as well. And then from a kind of ward perspective, you go in, you get your handover with everyone as well. It's kind of like a physical health ward. You get maybe assigned a couple of patients. I've not been on a inpatient unit for a little while, so I'm just trying to reflect back on that. So it's all about kind of therapeutic engagements. So a lot of times in mental health hospitals, you won't wear uniforms. You'll wear like normal clothes, so it's not like a barrier of you and
Yeah,
them.
yeah. I saw that because I was
Yeah.
like, excuse me, you're a nurse, you're not allowed to use nails and jewelry and everything. And she was like shimmering a lot. I was like, hey!
Yeah.
I was so jealous. I was like, I might consider doing mental health just for that.
Oh, there's more to mental health than that.
I know, well, I'm joking.
I know.
Right. So, so interesting. And I've got something to tell you
Yeah.
for so long.
Mm-hmm.
And while you were describing how a day in your life is, I was just thinking. So I went to Denmark
Yeah.
in the winter.
Okay.
There was a train that would take us to the city. And every time we was going on that train to go to the city center, which was like every day,
Yeah.
I would see this massive hospital. And then one of the people I was with, he was telling us that this was a hospital, a psychiatric hospital. And it was so long, Shauna. It was
really?
so big. I was like, it makes sense because Denmark is quite a sad country in regards to weather.
Yeah.
So a lot of people are gonna have bad mental health.
Yeah.
So it makes sense, like people do struggle, and you can see the difference in the community, in the weather, the way they interact with each other,
Yeah.
the relationships, everything is going to be different. So it was expected for me to see like others living their lives
Yeah.
for that to be happening. That would be the result of poor communication, no smiling, no, they're polite, but like don't get too close to me, kind of.
Right. Okay.
But I don't want to say bad about because I don't know much about the culture.
Yeah.
But it was a very cold interactions, I would say.
Okay.
Like I was coming out of the apartment, they wouldn't say. I was like, "Hi, good morning." You know, I was like saying hello to the neighbors, not even a smile. I was like, well, that reflects on the hospital size as well, obviously.
Yeah, I think it's an interesting one. I don't know too much about it, so I don't think I can comment too much.
Mm,
But it'd be interesting to kind of look at, like, compare maybe their rates and our rates, or even somewhere like
mm,
Indonesia. Like, we were
yeah,
there, we saw some of the mental health facilities there, and they are some of the friendliest. I think they are the friendliest people I've ever met.
met. Same.
Like,
I
yeah,
agree. Oh,
I know.
I miss it so much. I miss Bali, like,
Mhm.
honestly.
Yeah.
I was talking to somebody last night. Oh, yes, I was. I was
Mhm.
talking to one of my colleagues at work about Bali.
Yeah.
How great it is.
Mhm.
How, like, I know now. I was telling her, I know now what people are talking about. Like,
Yeah.
you know,
Mhm.
it was just such a great vibe. Honestly, it was
Yeah.
so cool.
Was it 2 back-to-back weekends we went, or was it like
Hmm.
one weekend, one week off? It was back-to-back, wasn't it?
I think, did we went there? How many times did we go
I
there?
think we went
Two,
twice. Yeah.
2 times?
We spent.
It was not.
Yeah.
It was not weekend after the weekend. I think. You think?
I'm not sure.
I think it was 2 weeks.
Was it. Yeah. Okay, that would make sense.
Yeah,
I think
cause
it. Yeah.
yeah, cause we went to do the.
Oh, we did. We went to
Mhm.
Mount Mariapi.
Yes, 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 yes,
Right.
yes,
Yeah.
yes. Oh, sorry. So yeah, well, I think this is a great introduction to the second topic, which is a travel chart.
Oh. Okay.
So Indonesia and with a side of chaos. Let's rewind to a month of heat, nasi goreng, and our makeshift spa days in Indonesia.
Yeah.
Well, it was not kind of like it was wild. It was so
Yeah.
wild. We overcame so many things.
Mhm.
Like the heat was like
Yeah.
God.
It was just everywhere.
The humidity was
Mhm.
something else.
Yeah.
What else? The food was different. The community was different.
Yeah.
They were taking pictures.
Yeah, we'd
We
be
were,
walking down the street and there would just be almost people following us, wouldn't there? Just
yeah,
taking photos, even in the hospital. We'd be working and there'd be patients that were quite poorly. I mean, I was in the intensive care unit one day, and some of the patients and their families were just videoing us as we were,
oh,
I was just like, oh my god.
oh my
Yeah,
God, it was wild.
yeah,
We had a what's it called, earthquake.
yeah, that was an experience as
Shauna
well.
was terrified. So I'm used to it because I'm Portuguese, so we've got a
Oh,
few.
really? Yeah.
So I was like chill, but Shauna, she was praying for her good life.
Yeah, I'd never been in an earthquake before. So the thing is, I didn't realise it was an earthquake at first. I just thought I was really tired. So it wasn't until everyone started screaming and telling me to get out of the room that I was like, oh, okay.
I'm naked.
Yeah, luckily I wasn't. Could you imagine if I was? And like, so most of you guys were like in bungalow things, weren't you? Whereas
Yeah.
I was in like a room that had a room above it. So like the whole thing just shook.
Yeah, because Arman was not in the room.
No.
So I was like, well, I've got no one to, like, let me just get
Yeah.
out of my room. Then I was like, Ada, was it me? Like, am I Delalo at this point?
Yeah,
Or
I thought I was really. I was like, am I that tired? I'm starting to,
this
you
was
know.
like towards the end days
Yeah,
of
we were
our trip.
literally. It was like 3 days before we flew home
Oh my
because
God.
I was writing. We did like a presentation thing
Oh
before we
yeah.
left.
Oh, I used this
Yeah, you
uniform.
did. Yeah.
Oh my
Yeah,
God,
so
great
I was
day.
writing that. But do you know what really made me laugh is we all gathered round the pool, which was the one thing all of us put in our risk assessment not to do if there was an earthquake. But
So yeah,
yeah,
it was mad.
it
We
was.
saw many other things, but now I just need to ask because we've upgraded in our podcast.
Mm.
We now have a producer. Please,
Oh.
producer, could you please tell us if we are still recording?
Yes, we are still recording.
Thank
Amazing.
you. Thank you. Right,
Oh,
this is
God.
fantastic. Yeah, we even saw like a lady Ah, this was so sad,
Mm.
honestly. We've cried so much. It
Yeah.
was so intense.
It was our first weekend there as well. We'd only been there 3
Was
days.
it? Oh, I can't even remember. It was
Yeah.
so intense. I can't even
Mhm.
distinguish dates. But yeah. So yeah, was it first week?
It was our first ever weekend. So we'd literally only been there 4 days, 4 or 5 days. Went into town, didn't we? Had it's a really nice day. Like, we
We
met up with some
did.
of the kind
Oh,
of the locals. We were shown around. We did some bartering. I think you bartered for that outfit on that day, actually. Mm.
thank
Um,
you.
then then went out for dinner. And there was problems getting taxis, wasn't there? So I think we
Oh yeah, yeah,
split.
yeah,
Yeah, we split into
yeah.
two groups.
Yeah.
And it was in the taxi home we went past like an accident, and I think it really affected me because I wasn't in the mindset. So, like, on placement or working, I'm in the mindset to deal with situations like that. But in my head, I wasn't prepared to deal with something like that, which I think is why it was just such a shock.
So what happened was we're on the way to home on
Mm.
our taxi, and basically we saw a crash. So this lady that crosses this street for like her good 50 years, she
Mhm.
was about this age.
Yeah,
She was hit by
it's a moped.
a moped,
Yeah,
and she was dead on the floor. But I was like, please stop the taxi. I'm
yeah,
gonna save some lives. Obviously, I always try to do
yeah,
that.
yeah.
I think I don't know. I'm a bit irrational. I always
No,
try to help if I can
yeah,
anybody.
definitely, yeah.
So I was just, please stop the taxi, and you know what's happening, and then they all realized. We all came out of the taxi. The taxi
Mm,
so kindly waited
yeah,
for us. I thought it was just gonna run away because
had all our
that
bags in it and everything, didn't it?
we just fucked off.
Yeah. But he tried
And
to warn us
I
not
was
to go,
trying
didn't he?
to get,
He was
yeah,
trying not to let us out.
yeah, yeah,
But yeah.
trying to protect us, that good man.
Mm,
So yeah, this lady was on the floor. There was a puddle of blood.
hmm.
Can you say that? Puddle of
Yeah,
blood
yeah, there was quite, yeah.
around her, and I was like, "Look, I can like, shall I just try?" I didn't know quite what happened,
Mm,
but they were like, "No, no, no," and nobody letted me get close to her. So
no.
even if I wanted, I couldn't, because like you need to respect the community as well. We
Yeah.
can't just like
And
get
it
in
kind of
there.
happened the other side of the road because she kind of made it across to the other bit. But where I was, they were holding me as well. We weren't
Mhm.
allowed over to even to you.
So a bit of everything in this trip, to be
Yeah,
honest. That really took a good place in our
mm,
day.
yeah,
We had a beautiful chat after that.
yeah,
We all opened up, we all
hmm,
cried, we all bonded. It was
yeah.
beautiful. I was like, this is the type of energy I like. It was so nice. So I think this is one of the unforgettable moments of our trip,
Yeah,
and it still stick to us, doesn't
hmm,
it? Like,
yeah.
it was definitely that one. So, what did that trip teach you about yourself as a nurse and as a person?
As a nurse, it taught me to be grateful for what we have. Especially going into the like hospitals and healthcare out there. Don't get me wrong, they're amazing facilities. They are really good, and
Yeah.
they have a healthcare system similar to us, a little bit similar.
Hmm.
Um, but I think compared to our services here, pain relief isn't often given to patients. So myself, we were kind of put into pairs, weren't we? So I was with one of our other colleagues who's qualified now. She
Cheers.
is
Oh,
she's
I'm
in her
so.
masters now, bless her. Um, so we were in a group together, and we were in ED, and we had a patient that came in with he was in a moped accident. Kind of came in and had a lot of wounds, and we thought he had an open fracture on
It
his
was an
leg.
open. Was it open Hedefima?
Yeah, almost. Yeah, like it looked like it.
Yeah.
So we wanted him to have pain relief. They told us no. He's a public patient. He doesn't qualify for pain relief.
So
So
we need to
yeah.
explain that public thing. So in Indonesia, they've got different types of setting of care. It's all within the same hospital, but it works kind of like America.
Similar, yeah.
I don't know if it happens like that, but basically, what happens
Actually, I
is,
don't think it is. It's more like ours, isn't it?
Mhm. Well, you really don't get served or taken care of if you don't
Mm.
have an insurance or money to pay for your appointment. You really not. They send this poor man home.
Yeah, me and my colleague went for our break, came back and they'd sent him away. Didn't give him an X-ray, didn't know if he had a broken, an open fracture or anything. Didn't give him any pain relief or any antibiotics. He was just sent on his way, and we were told, well, if he's ill, he'll come back, and if not, he's either fine or not here anymore. We were just
It
like,
was mad. It was
wow.
so mad.
Yeah.
It's crazy to think
Mm.
that. That's what did you learn about yourself then?
I think I learned that I could do a lot more than I thought I could, especially like I didn't know any of you guys when I don't think any of us really knew each other before we
No,
went.
no.
Like
We all
Savannah
met in the
said, yeah,
airport.
we all met in the airport. And before, like I'm still quite a shy person now, but compared to what I was, I'm very different. I can definitely shout a lot louder now. Definitely, yeah, definitely. Put boundaries in a lot more, especially when it comes to patients and their care. Which I'm very glad about. Like I could do it before, don't get me wrong, but I'm definitely a lot more firmer with it now. It taught me all the stuff that's out there. Like, like Sylvana said, we went to Bali a couple of times. We saw a volcano. We were in an earthquake. We were in a fire as well.
Oh my god,
Yeah.
massive fire! A massive
Yeah, it
fire!
was huge. We got detained in the airport on the way into the country. Like, there was a lot that happened.
It was tragic.
Yeah, yeah.
Honestly, it was. I've learned so much about myself
Mm,
because after COVID,
mm,
this was the first group interaction, like deep down. We had nobody but ourselves, like
yeah.
that took that trip
Yeah,
because
we
we're
were on the other
only
side of the world. We had nobody that we knew other than each other. You
exactly.
know.
It was, oh my god, I've learned so
Mm,
much about myself. Some parts I'm not very proud of,
no, but
but
other parts you should be really
is
proud of.
is like it's crazy like how you actually bind yourself now
Yeah.
from who you used to be
Mhm.
as a child. And
Yeah.
if you would tell this to the little Savannah,
Oh my gosh.
I would be like, you're joking. So this now is a new part of the episode. We are starting this new line. Can we say line?
Oh.
Yeah.
Yeah.
So
Sure.
you are the first guest
Oh.
to
Okay.
have this. So we're gonna play a game,
Oh my
and
gosh.
you need
Okay.
to give it like short sentence for
Okay.
these questions. So welcome to quick fire round.
Oh.
Right. All right, Shauna. Time to scrub in
Mhm.
for our quick fire round.
Okay.
Answer fast, no thinking too hard.
Okay.
If our trip was a musical, what would be the soundtrack?
um. Probably. What, like a musical, like
Mm-hmm.
one that already exists.
Yeah, and you can give us a little sing.
I'm not singing, but it'd probably be everybody's talking about Jamie.
Right.
So all about finding yourself, who you are, little journey. Yeah, probably that.
So tea, coffee on a chaotic shift.
Tea.
Favorite musical number to belt in the shower?
Oh, Wait for Me from Hades Town.
I told you, she's saying them all. One piece of advice you give to your younger self?
Just keep going, get through it.
I love it. If your life were a musical, what would it be called?
Chaotic Life of Shauna or something like that, probably.
Did your nurse brain ever switch on while we were abroad?
Yeah, pretty much every day, all the time.
What's something about me that surprised you during this trip?
I think how genuine you are. You are what you like. You see what you get. Like, what, I can't think of the saying.
Yeah, what you see is what you get.
Yes, that's it. Yeah. So I
true.
talked to you before, and I was like, this girl seems too good to be true. I'm probably
Really?
yeah. I was really worried. I was like, oh my gosh, what if I get to like the end of 5 weeks with her and we're not friends anymore? And then I was like, no, for like a year, you're just you and you're great. So yeah.
Well, I kind of asked for it. What's your ultimate travel survival kit?
Good pair of headphones, noise cancelling.
That's so true. It was so nice in Indonesia.
Yeah.
Right, Shauna, thank you so much for sharing your heart and humor with us. From nursing shifts to scooter rides in Yogyakarta, you've proven that kindness, control, and chaos can live all in the same nurse.
Oh.
Before you go, we need to take a little thumbnail. And thank you so much for watching. If you like this podcast, please subscribe. I need your subscription to get going because I get no money from this and it takes forever to edit this. So if you do like it, please subscribe the channel or just leave a little thumbs up. It's so important and you pay nothing. Thank you so much for watching. Bye.
Bye.
Thank you.
There's two teams. We have the south and the north. Should we start again?